Hey guys, join me for a short routine and I will be guiding you to the straddle stretch. So if you're struggling with a lot of tightness through your inner thighs and maybe simply a lot of stiffness in that hip pelvic area, then those drills should help you. Let's begin. First, we warming up. If you haven't done anything yet today, then place yourself in 4-point kneeling with hands below the shoulders and knees on the ground, and begin creating circumduction. So we're moving the pelvis on top of the thigh bones with the goal here to lubricate the hip joint surfaces, the inside of your acetabulum, the femoral heads, and we're sitting back. Okay, prioritize movements in all directions, forwards and sideways and backwards. So one hip goes into abduction, the other one goes into adduction. If you're feeling a lot of restriction here already, then check out my other videos from the Hips 360 series, where I'm guiding you through external rotation, as well as episode 3 for internal rotation. Join me in this sort of position. Some of you will keep the hands on the ground. Some of you will stay up with the pelvis. Some of you will sit back a little bit. Maybe you will create extension in the toes like this and sit back. Some of you will keep hips up and go down on the forearms. See whatever works for you. If you're not used to doing this, maybe your hip abduction is restricted, limited, you already feel uncomfortable, then simply stay here, sit back with your pen. What are we holding? Okay, so I'm gonna start a timer, just because sometimes when we get uncomfortable, we try to rush through the stretches. I know that a lot of my clients say that when they do it with me, they do it for the right amount of time, while when they hold it by themselves, they just stop as soon as it becomes uncomfortable. So we holding, and ideally for those sort of stretches, I would recommend normally 90 seconds minimum. So those tissues, those connective tissues, the mechanoreceptors embedded in the connective tissues can perceive that stimulus. So we are 35 seconds in. I'm going to hold a little bit longer. After that, I'm going to guide you to contractions. We're going to do 3 rounds of activation of your adductors, so we can also start layering a little bit more neurological control over that range of motion. So you work at the range that it's sustainable. Just be mindful that you may feel this at the back of the knee right here, where your medial hamstring, semitendinosus, and the membranosus cross, as well as there is a one long adductor muscle called gracilis that crosses the knee. So you may feel this around this area. That is absolutely normal. We expect that, and we expect to feel that because that's where attachments of the muscles are. Of course, don't go so deep that all you're feeling are those tendons. You're trying to feel the stretch in the belly of the muscle. So hopefully in this mid space. Okay, that's minute 40. And let's begin our contraction. So guys, 20% of your max strength, or maybe even 15%, we're gently driving foot down, like you're trying to engage these muscles and bring the leg back to the midline. We're gonna gently press for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stop pressing. And if you can, you let either leg slide further out. Maybe some of you will sit back if you're up here. Just trying to deepen the position if possible. So those are sort of post-isometric relaxations. There is this post-contraction relaxation that occurs in the muscle, and that's what we're trying to capitalize on. Okay, round 2. We're pushing down. So guys, between 10 and 20% of your max contraction, pressing down through the floor. 7, 6, 5, 4, 3, 2, 1, and relax. Okay, we've got one more drill like that, and then we're changing sides. Ready? Press down, round 3 and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. So guys, we're gonna hold here just a few more breaths, and we are approaching 4 minutes here. So this is a great place to start. You're working unilaterally, affecting only one side, one adductor group. Now slowly, safely, come out. Push down through your feet, push down through your knee. I'm gonna reset the timer, guys. And again, if this feels a little bit sore and uncomfortable, just move your pelvis from side to side, because obviously our hip was also flexed, so you may feel quite a lot of discomfort, maybe soreness around here. Little circles, and guys, you're gonna move over to the other side. I'm gonna do exactly same thing, all right? So, other leg, abducting, and maybe that's the position you go into. Maybe you go down on your forearms, more hamstrings here. Maybe you sit back a little. Maybe you use the block and put the block below the pelvis, even if it's high up here. Maybe you place a pillow or block between the heel and the hip, okay? Cushion the knee. First of all, let's make sure the setup is sustainable. And my timer is on now. We're gonna go into first 90 seconds passive hold, okay? Focus on deep breathing. You know, those kind of stretches you can do while listening to a podcast, while watching TV, or doing it with someone to keep you company. The time then flies faster. Prioritize your breath in through the nose, out through the nose or mouth. A lot of guarding may dissipate, a lot of that kind of feeling of contraction may dissipate with time, okay? So if you relax, you put your body into the parasympathetic state, that relaxation state, which you can only really achieve through your breathing, like control your breathing, then you may be able to go a little bit lower, okay? And again, if there's a lot of pinching here, we may want to focus first on rotation. So again, go back to my rotation videos for it. All right, guys, so 1.5 minutes, and we start creating contraction. We're pushing through the big toe, inner heel down towards the ground. So notice that the hip is, if you're up here, your hip will be slightly internally rotated. If your big toe is slightly pointing to ceiling, that's fine, but explore different angles. I'm preparing for straddle and ultimately from straddle to the side split. So I will work with my big toe towards the ground. Relax, okay? I'm gonna do round 2, 10 seconds contraction. Ready? Pushing through the inner foot down into the ground. 5, for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Ease off, and maybe you're holding the same position, or maybe like me, I'm going to show you what I typically do. I go even wider, so I'm sort of having like a almost frog position or half child's pose on my right, and I'm already building more towards the straddle / split. But if this is not available, that's fine. Just stay here. Last round, we're contracting, so isometric contraction, slow, low level contraction, okay? For 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Hold here for a little bit longer. So this is pretty much 3.5 minutes, just holding and contracting. And even if this is the only thing you're doing for your inner thighs right now, that may be perfect and enough, okay? I'm gonna show you 2 more setups that you can do before going into the straddle, or to make the straddle stretch, that seated forward fold and ultimately side splits, a little bit easier for you. Last 3 big breaths, in through the nose, out the nose. And I'm just keeping you here until we hit 4-minute mark, okay? Which is now. So stretches are even both sides. Safely, slowly come out of the stretch. Okay, so guys, first setup done. And then you may want to gently move your hips. Be gentle. No rapid, sudden movements. Little movements through the hips, little circles, maybe child's pose, sit back and relax. All right, guys, second movement. We continue with something that hopefully is sustainable for many of you. You will need the dumbbells for this setup. And you may want to start with either sitting on the ground or you can sit on the cushion. So I'm going to sit on the cushion, grab my 2 dumbbells of 5 kgs, sit against the wall so my back is supported. And we begin with butterfly position. Now, for those of you who are here and you feel like your knees are up here, maybe suck something underneath the thighs. So the thighs, all these muscles can stop gripping and the legs can relax and fall open, okay? And maybe over time you'll be able to lower and lower the support. At the same time, to create more external rotation in the hips and target your inner thighs, create more abduction, you can lean forwards, okay? You can use your forearms if your knees are up here and just use your arms. Otherwise, if you have the blocks, you can go into this sort of setup. So your thighs can relax and you lean. And maybe that's all you're doing. You will just hold it for a couple of minutes or more. While if you feel like your knees can drop a little bit more, lower the support, okay? I used to feel a lot of pinching in my 20s, especially when I would be working so much on my flexibility and I would not have that much control in my hips. I would always feel some sort of pinching in the hips, so I would always use some support, okay? And maybe that's the position you want to go into. Light weights or heavier weights, and we're just gently pressing. So this is your passive position. This is a passive stretch, okay? And maybe that's all. You can deepen this by gently leaning forwards. And if this feels manageable, then of course you can remove the support or reduce the support. So I'm gonna go even deeper. If you're happy with it, go with me. So now I'm gonna load my hips with those extra weights. You may want to start with something light, couple of kilos on each side. I'm having my 5ers and that's still manageable for me, okay? So guys, we're holding till the 90 seconds mark. So I'm gonna keep us here for a little bit longer because this is a follow along. So I don't want to just brush through the drill. And again, if you are quite flexible already, you want to build a little bit more control at the end range, let me show you another progression. So I'm elevating my hips, elevating my feet, And in this way, I will give myself a little bit more space to challenge my range of motion. So that's for a little bit more, those of you who are a little more flexible and you want to build more control from deep position. So whether your legs are like mine, or whether your feet are on the floor and knees are a little bit higher, we are working with contraction. So you're going from abduction, external rotation towards neutral. So your adductor muscles, a bit of hip flexors, internal rotators will be firing. So you may feel your anterior fibers of the glute medius, glute minimus. You may feel your tensor fascia lata. I mentioned all those muscles in the video when I talked about internal rotation of the hips. And also now we're talking about adductor muscles. So most of adductors attached towards the around the pubic bone and then at the different levels of the thigh bone. So they do the squeeze. So guys, this is another drill you can do. Maybe that's the only drill you decide to do. But if you're building towards straddle, or you want to build towards side splits, or you want to make your squats better, your lunges better, or movements such as cutting, lateral movements in sports, then this is worth training. Okay, so my goal was to go for 90 seconds passive hold and then about a minute of gentle pulsing. Just make sure you're not feeling discomfort or crazy pain there in the hips, or any pinching or any sharp sensations in the hips. It should be mostly fatigue around here and maybe through the sides of the hip. Okay, let's come out of here. Next setup, guys. I'm gonna take you into the next one. We're gonna do open side kneeling. Have your weights ready. Let me guide you through the setup first. So guys, open side kneeling, which means that from lunge, you're going to gently abduct the hip in flexion. Some of you will be able to go quite far. The common mistake that I see is that people take their leg sideways or take their foot sideways, but the knee and hip cannot keep up, and they end up being in something like this. You see that angle, lots of pressure on the medial knee. So we actually want to work on hip mobility here, or simply move your foot further forwards, so you end up with knee tracking over the second, third toe roughly. So we're protecting knee ligaments and the knee joint and the meniscus. Okay, so from here, we're going into deeper knee flexion, ankle dorsiflexion, deeper hip flexion with abduction. There's more abduction here. So again, that may be a limiting factor. If this is pinching, what you can do is elevate this leg, and that's going to be less abduction here, okay? But more flexion. So see what works. Maybe you need extra cushioning for the knee, okay? So that's the setup. Now, once you have the setup, you have the alignment, let's go. We're going to do kinetic stretching. So we're pulling ourselves into the position. I want the knee to go slightly ahead of your toes and then push out of the position. And again, you're pulling yourself into the position. So I'm trying to really contract my hamstrings here, calf, bend my knee, use my hip flexors. And then I push out using my quads and glutes, and adductors contract. We're lengthening. The pelvic floor will open. Exhale. Bring it back, okay? I want my heel to stay down because I will be driving the heel down and away from me as I'm coming up. So guys, this is, you can treat this as an intro. Just doing 8 to 10 slow reps like this. And then we're going into the passive hold. You're gonna stay there with me for about 60 seconds. Okay, we're gonna be deploying contraction of the adductors. Legs will be getting tired, no doubt. You can go a little bit lower if you're comfortable. You can come up higher. maybe your leg is already a little bit tired. Okay, if you're not used to this position, there will be a lot of gripping happening, maybe a little bit of shaking, but that's okay. You can always get out of the position and come back in. So we are 40 seconds in, and in a moment, we're going to do some engagement of these muscles. See where your bottom position is. Where is your max stretch, if you can. Okay, guys, 60 seconds, 1 minute in. Now you're going to push your thigh into the hand. Arm is resisting, leg is pushing 10% effort forwards, engaging these muscles. Continue for 5, 4, 3, 2, 1. Relax. I'm going to try to go a little bit deeper into abduction, stretch these. I'm moving my pelvis out there, more to the left, away from the leg. Round 2, push your thigh into the arm. 10% effort. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Some of you may need to come out if it's really gripping, okay? The muscles will be tired. I'm gonna do one more thing, one more drill like this. Ready? 5, pushing into the hand. 10, 9. It's a gentle contraction. I'm not trying to overpower my arm. My arm is not moving at all. 4, 3, 2, 1. Done. Slowly come out of the position. Okay, so there was a movement, kinetic stretching, there was a passive hold, and there was inner thigh contraction. Let's do the other side. So guys, set up, making sure you're comfortable, maybe foot on the block, maybe knee on the cushion. Ready? Stay tall. Pelvis square towards the camera. I'm gonna go with my knee ahead of my toes. Pulling myself down and into the stretch, pushing, using my quads, adductor glutes on the left side. Exhale. So I'm slowly going into elongated position of the muscles, but they're not relaxing. This is not passive work. This is already creating more control over the range of motion. I'm going as far as I can, but I don't let go. I know I could drop probably another degree or 2, but I will not let go completely. I'm controlling that movement from the beginning to the end. So guys, usually 8 to 10 reps like this. This of course could be done with weights as a progression, but we're not going to do it in this particular video. Okay, so I'm going to do a couple more, and that takes me to pretty much 90 seconds of work. Then we're going to hold at the end range. Get ready. You can grab a block. And I'm just trying to affect these tissues. And I am rotating towards the sky, right? Towards the ceiling. So the leg is abducted, my left side, because kind of that's the position you need for successful straddle. Okay, 30 more seconds, just holding, and then we're deploying contractions from these muscles. 15. Yes, you will feel like you want to stop, but do not. Just try to hold, fatigue those muscles a bit more. And guys, we're deploying our first contraction. So I'm going to back off a little bit, rotating my ribcage slightly towards the ceiling. And I'm driving my thigh into my hand. Very gentle contraction. Adductors. 7, 6, 5, 4, 3, 2, 1. I relax. I may go a little bit deeper into the stretch. It doesn't feel like a stretch really. It feels like just holding half squats. If you need to back off for a moment so we can reset. Ready? Round 2. Trying to get into a little bit deeper position this time and deploying 10 to 15% of my max contraction of those adductors. Just counting down, and 5, 4, 3, 2, 1. Sinking deeper, or if the leg is really tired, back off for a second. Maybe your hip flexors and lateral muscles of the hips will need a little break. And guys, we heading into the last one. Okay, trying to find the stretch. And then from here, contracting, pressing forwards for 10 seconds. 8, 7, 6, 5, 4, 3, 2, 1. Push slowly back into position. Okay, guys, so we've worked on adductors, a bit on the hamstrings, and we were deploying contractions in all of them. Okay, so those are fairly accessible positions. So whatever your level of flexibility, mobility is, whatever your age is, from midlife onwards, you can apply those positions. What we ultimately working towards, which I will break down and give you more preps in another video, but ultimately we want to go in here, right? Which requires adductors, hamstrings to lengthen, our hips to externally rotate, and then we will be hinging from the hips, okay? We're gonna cover more of the elements for this in the future videos, but the movements we've just done are basically setups and preparation to make this position and this position, or even going towards the side splits, more accessible. Your body needs time, you need good inputs, so this position can be done safe. Let me know how your progress is going, and I will see you in the next follow along.